interaction or point of contact, I guess, that they would receive would be a text invitation message from the Ministry of Health. So the way they're selected is we look at their background, like when was one of the biggest criteria that we look for is when was the last dose, which is the second dose of COVID-19 vaccine they had taken. So usually we send the invitations to participants who had taken their second dose between 2 to 6 weeks ago. And then when they receive that text message from the Ministry of Health, they are required to send a response whether they accept the invitation or they decline the invitation. So accepting the invitation would mean that they are willing to give their blood to us as a sample that we can use to test if they actually have the antibodies for COVID-19 virus or not. So if they agree, then they would also agree to the appointment that's allocated for them in that text message, in the same text message. And then we can expect them on the day that's given to them to come to us to give their blood. First, as I think I mentioned earlier, your second dose of your COVID-19 vaccine has to be at least between 2 to 6 weeks before your blood collection. Secondly, you have not been infected with COVID-19 virus, because this is a vaccine research, so the antibody response that we want to measure needs to be coming from your immune reaction to the vaccine that you have taken, not from the virus that's infecting you. Because both vaccine and virus would trigger an antibody response, but this is research about the vaccine only, so we're only interested in people who have never been infected but have taken the vaccine, of course. And then another criteria would be no travel history, obviously, because that's just gonna increase your likelihood of being exposed to the virus. So we want to exclude that from our research pool. These are just some exclusion criteria. We also have some inclusion criteria. So among others are the vaccine brands. So we're only currently looking into Sinopharm, AstraZeneca, and Moderna. We haven't included in our population pool those who had taken Pfizer. What else? We also cover a lot of clinical and demographic variables. For example, we have like a way of making sure that we have a group of people from over 60 years old, over 40 years old, over 50 years old, all the age strata we will cover so that we can represent the entire Bruneian population. We also have a range of people who have different clinical background, people with diabetes, hypertension, kidney diseases, and things like that. So that we end up with a representative population for our study that reflects the Bruneian population. Yes, I mean, it will be interesting to see how different the antibody response is to the vaccines in young adolescents. But I think the research protocol is a bit more difficult because you would need consent. It's more tedious. You need parental consent, and I don't think Brunei is ready for that yet. We don't have research of that scale yet. It's been one of the biggest questions that I receive from our project hotline is that what's in it for them? I think like probably 90% of the calls I receive all ask the same question. What's the incentive? What does it mean personally? A lot of people want to know if the vaccines can actually work for them, are actually working for them, right? And I think the only way to know if it's working for them is either you get yourself infected and you survive the infection, or two, you can actually measure your antibodies. They are protective against you, so you don't have to expose yourself to know whether the vaccines have worked for you or not. So one way to do that is by applying for this, registering or signing up to this project. And it really doesn't take that much. We just need a very small tube of your blood, and then we extract the antibodies out of the blood, and then we measure whether or not you have the antibodies that can protect you from infection. And I think that's a very important question to ask as an individual. Like, what if your vaccine brand choice isn't ideal for you, right? Like, everyone at some point had the choice, Moderna or AstraZeneca as adults, like healthy adults, right? But you probably choose Moderna because it's a new technology, RNA technology. I want to be in the new brand, right? Everyone is like, oh, I'm team Moderna, I'm team whatever. But really, does it actually work for you? Because everyone is different. Like, we could be the same age, but your clinical background is different. Your reaction to the vaccine that you took is probably different. So this is actually one of the ways you can know whether or not the vaccine has worked for you without getting yourself exposed to the virus. And it really doesn't take that much. Like I said, like a small sample of your blood, and then we can measure, are you actually protected at this point in time against the virus? And this is a very important question to ask, because we're now moving into the endemic phase, right? At some point, we're gonna have to live with the virus. So you probably want to know then whether or not you'll be protected if you are actually living together with the virus, right? Can you actually coexist together with the virus? So it's good to know how much antibodies you have right now. And if you have a low antibody level, then maybe you should consider getting a third booster dose soon, rather than later. And then that's just on personal level, but really on the national scale, it's really going to answer a lot of important questions. One of the big ones would be how to design the next vaccination program for booster. So maybe the population with vaccine brand X, that actually, coming out of this research showing with a very low antibody level, should be put first for the booster dose, right? For example, if you are over 60 years old and you had taken brand A, and then as it turns out, after coming out of this research, your antibody level is very low, then maybe the government can consider pushing you first for the third dose so that your antibody level can go back up again and you're protected. But there's no way for the government to know that unless we sample your blood. And it also can help answer the questions like which vaccine brand is the best for our population, because all these vaccines are produced in other countries, right? They were tested in a completely different population, different race, different, all kind of clinical background. So we don't know if it works similarly in our population. So the government really needs to know all this information so they can design the next steps of the vaccination program, really, and how to control the pandemic as we move into the endemicity. Intra variation in immune responses. I think this is what we want to capture through this project. Like, you can be of the same age, same political background, same everything, but your immune response to the vaccine that you had taken might be different. So we want to be able to capture all this little information, basically. And then maybe with this information and details, we can help understand our immune responses and towards the vaccines better. We really hope that the public will come forward and register for, if they get the invitation, please sign up. It will really help our government in formulating the next step in controlling the pandemic, because the information that will come out of this research will help answer a lot of questions about where we are now in terms of our public health control towards the pandemic. And if we really want to move on from this pandemic or try to even live with it, this is actually one of the ways of doing that, like, answer research questions and then see what we can work with right now.